Starting July 1st, 2026, Medicare is doing something it has never done before. For the first time in its 60-year history, Medicare will cover weight loss injections. Drugs like Wegovy and Zepbound, the same class of medication as Ozempic, for just $50 a month. But there are catches. Several of them. And if you don't know the rules before you walk into your doctor's office, you could end up paying full price. GLP-1 drugs work by mimicking gut hormones that regulate hunger and blood sugar. They slow down digestion and reduce appetite, and in clinical trials, they produced average weight loss of 15 to 20% of body weight. There are 4 major drugs you've heard of. Ozempic and Mounjaro use the same active ingredients as Wegovy and Zepbound, but they have different FDA approvals. And that distinction is everything when it comes to Medicare coverage. Here is the part most news articles got wrong. Medicare is not covering Ozempic for weight loss. It is not covering Mounjaro for weight loss either. Those drugs are FDA approved specifically for type 2 diabetes, and Part D already covered them for that use. What is new is coverage for Wegovy and Zepbound. Same ingredients as Ozempic and Mounjaro, but these two are FDA approved for obesity. If you go to the pharmacy expecting a $50 Ozempic copay, you will be surprised. There are 2 requirements, and both must be met. First, you must be enrolled in Medicare Part D. Original Medicare alone, Parts A and B, does not qualify. You need an active drug plan, either a standalone Part D plan or a Medicare Advantage plan with drug coverage. Second, your BMI must meet a threshold. BMI 35 or above qualifies with no other conditions required. BMI 27 to 34 qualifies only if you have at least one condition on the CMS qualifying list, which includes a previous heart attack, a previous stroke, symptomatic peripheral artery disease, or prediabetes. The $50 copay sounds simple. It is not. 3 things in the fine print that most people won't find out until they are already in the program. First, this $50 fee sits outside your normal Part D benefit. Even after you hit your $2,100 out-of-pocket cap, you still owe $50 a month for this drug. Second, if you receive extra help, the low-income subsidy, you cannot use that benefit to reduce this cost. Some of the lowest-income seniors actually pay more per dose than higher-income ones. Third, prior authorization is required. Your doctor must certify your BMI and document that lifestyle changes are part of your treatment plan. This does not happen automatically at the pharmacy counter. The bridge runs from July 1st through December 31st, 2026. 6 months. Then it ends. Starting January 1st, 2027, it is replaced by a new voluntary program called the Balance Model. But here's the problem. Participation by Part D plans is optional. If your plan does not join Balance, you lose Wegovy and Zepbound coverage on January 1st. To keep it, you would need to switch plans during open enrollment. Open enrollment runs October 15th through December 7th, while the bridge is still active. That window is your chance to check whether your plan is joining Balance for 2027. Do not wait until January to find out. 6 steps to take before July 1st. 1. Confirm you have active Part D coverage. If not, you cannot qualify until you enroll. 2. Talk to your doctor before July 1st so the prior authorization paperwork is ready when the program launches. 3. Confirm your BMI and whether you have a qualifying condition if your BMI is between 27 and 34. 4. During open enrollment in October, check whether your plan is joining the Balance Model for 2027. 5. If you receive extra help, do the math. $50 a month is $600 a year, and the low-income subsidy cannot reduce this cost. 6. Check CMS.gov for the final eligibility rules, which CMS is publishing this spring. Medicare covering weight loss drugs is genuinely historic. But this is a 6-month bridge, not a permanent benefit. The drugs are Wegovy and Zepbound only. The copay is $50 a month outside your out-of-pocket cap. You must have Part D coverage and meet the BMI threshold. And you need to check your plan's participation in the Balance Model before the end of open enrollment in December. Know the rules before July 1st, and this benefit could save you hundreds of dollars a month on medication. Subscribe for one Medicare update every week. No jargon, just facts.